Good afternoon, everybody, and thank you for the lovely introduction, Tim. Recently, Active Retirement Ireland launched a series of 12 podcasts called The Old Country, and this was to mark the UN Decade of Healthy Ageing. And in a way, I did an interview on the radio on Monday, and this did set me up and it was very thought-provoking, so it was very appropriate that I was able to attend, or it is very appropriate that I can attend here today. So, as Ireland's population is getting older, it presents a unique set of challenges and opportunities. The conference today addresses many of these issues. The UN Secretary states that ageism denies people their human rights and their ability to reach their full potential. The mission statement of Safeguarding Ireland says that it strives for an Ireland free from adult abuse, where everyone's rights are protected, respected and promoted, and protected and underpinned by safeguarding legislation. And the pursuit of this legislation is both necessary and urgent. And this will enable individuals and organisations to combat elder abuse, neglect and exploitation. I started working in 1973, which is almost 50 years ago. And that was the year that we joined, became a member of the EEC, I think it was then, or the EU now. And the following years, there was a huge amount of equality legislation introduced to Ireland. When I started working in 73, my male counterpart earned a bigger salary than I did. So we've come a long way this. So the question I ask today is, what legislation do we need to protect the rights of older people? I see basic rights in many ways of the older people. The right to timely access to medical attention at an affordable cost. I see the need for health promotion and the efforts being made to prevent the degenerative diseases that really affect our lives. So I would like to see a society where people can live longer, but live healthier and live better. Affordable housing. I think we all heard our President talk about housing in Ireland last night. I think he was on the button. The majority of older people in Ireland, they do not just want to remain in their own homes. They want to remain in their own communities. And they want to be there for as long as possible. And they do not want to go into residential care until it is absolutely necessary. We need an adequate supply of homes for older people who wish to right-size in their community. The age-friendly Healthy Homes Initiative, which is being piloted at the moment in 9 of our local authority areas, this supports people to remain at home and delay movement to a residential setting. So there are a lot of things happening to help older people to live well in their own communities. Transport is another issue that I think older people really need support in. I attended the Irish Rural Link conference lately. Many of our older people live in rural communities, and while they can have access to free travel, which is very much appreciated, but they do find it difficult to connect with the main trains and buses. The recent initiative, the Local Link, demand response transport, will help this. And from talking to some of my colleagues in local links in around the country, I feel that they feel that now should be the norm rather than the exception, where people can be picked up closer to their home if they have appointments or if they have, so that they can get to easy access to the local transport hubs. Connectivity. At the conference then said, would you put up with your broadband infrastructure, or would you put up with your electricity supply being interrupted the way your broadband infrastructure is? And I think we all know the answer to that. Many studies show that older people were socially isolated due to the lack of broadband infrastructure and knowledge of information technology, particularly during the global pandemic. This needs to improve. The public realm. Age Friendly Ireland has highlighted the importance of access to public public services, businesses, amenities and leisure activities so that older people can readily access all public facilities. Social and civil engagement. The voice and lived experience of older people must be heard and listened to. This will allow their full participation in civic society. And I'm glad to see that as one of the themes of the age-friendly strategy. Consultation. There are many consultations now taking place through the public participation networks. This is a huge opportunity to have the needs of older people's needs addressed. And I would strongly encourage this consultation process to be utilised. At the moment, the most latest one is consultation on library services. I think, I don't live in a town, but I think if I did live in a town with the library services, I would be utilising it to the best. But this is an opportunity for people to tell the local authorities, this is what we would want, and this is what we would need. And I think those consultations that take place through the public participation network is a great opportunity. The conference today will address some of the rights I've mentioned. I didn't mention about resources. Older people need to have all the resources, be it pensions, welfare, all the social protection. They need all the services and resources to live a healthy and active life. Many of these will be addressed today during the conference. Older people must have a sense of agency on their actions and decisions. Their autonomy and independence must be respected. And I firmly believe that this will reduce some of the elder abuse that is so prevalent in our country at the moment. Before I close, I'm going to make a few recommendations. We do need a commissioner for older people, and I'm looking forward to hearing that discussion today. The National Positive Ageing Strategy should be implemented in full in an integrated and holistic manner. Active Retirement Ireland has been campaigning for a long time for a senior minister for older people with one particular portfolio. So I started with a quote from the UN Secretary General. I'm going to finish with one. What is needed is a forward-thinking, rights-based approach that addresses underlying societal, legislative and policy structures that support long-standing assumptions about age. And I'm delighted to read in the foreword that of the annual report that this is seen, it's not a health issue, just a health issue, it is a total societal issue. Thank you very much.